And we also start sharing the screen, and yes, here it is. Well, and we can do like start with the beginning, and you can see the presentation. So this is the second part on Unit 5, which is about dealing with medication. And as we usually do, let's first start with some comments on your homework. So you were given to deal with some exercise with phrasal verbs that for you to refresh what you really remember about phrasal verbs. And there were some typical mistakes in the use of in the matching exercise, where the task was to match some phrasal verbs with their meanings. And here are the correct versions. I mean that if we mean suddenly appear or reappear, it should be flare up. So, and to become conscious, again, this is come around and spread from person to person, just go around. We can speak about some infectious disease that they spread from, they go around, which means that they spread. And so this is the right answer, correct answer. And there were also mistakes in the use of prepositions with the correct preposition with the phrasal to make the phrasal verb with the verb clear. And as you remember, there are three options here: out, in, up. So, and we should just understand from the context which preposition should we use. So if we just understand the meaning of the phrasal verbs, the first, if we use out, there is a clear out, means to leave a place quickly. Somebody leaves a place. And the example illustrates this meaning. He cleared out with all the money and left her with the kids. So this is he left her. And if we use the preposition up to make the phrasal verb clear up, it means to become fine, to disappear. This is of an illness, infection, and so on. The sky cleared up after the rain, like here. And if we use the preposition in, it is not actually a phrasal verb. Sometimes it can be used, but in very narrow meaning. And here is the example which illustrates the use of this verb. The diagnosis was clear in the first phase of the study, just separate words. And so if we analyze the meaning of all these phrasal verbs, which phrasal verb will be the best here? Which phrasal verb should we use? Clear out, clear in, or clear up? Sorry? Yes, you're right.
Clear up.
Clear up, yes. The best version was to clear up. Okay. So, and today we'll speak about phrasal verbs in details also. And first we should start with just yes, Ashwati.
Ma'am, we didn't present the last leaflet that assignment. Last group haven't presented that.
So the connection there is very bad. I can't can't understand what you're speaking about.
Ma'am, in last week, they had their presentation left. One presentation was left to present it.
And who do you mean? That was
It was Ashwati's group.
So I mean the presentation which was prepared by, yes, Ansila, Ashwati, and Ramisha. Okay, so look, we'll go through the class today, and at the end of the second hour, we'll listen to you. Okay. So at the end of the second hour, how much time do you need? How many minutes?
5 or 6
minutes.
5 minutes.
5.
5 minutes. Okay.
Maximum.
I'll give you 5 minutes at the end of the second hour. Okay.
Okay, ma'am. Okay.
So I mean that you remember the previous class we were listening to the conversation between a doctor and his patient, and the doctor was explaining the benefits and side effects of aspirin to the patient who was ready to go home. And so I would like you, as far as you are just advanced students and you know these benefits and side effects of aspirin, I would like you to make up just sentences with the help of these phrases, or use some other phrases to describe the benefits and side effects of aspirin. The phrases which are given here, and actually they are taken from the conversation which we listened to last class. Like you may use them and others, like you are explaining this to a patient. Do you see? Well, who would like to speak? Or do you need some time?
Ma'am, I would just like to know if you have any allergic to aspirin or not.
Okay. So you are asking a question. What about explanation?
Yeah, ma'am. From the first point, I would like to ask like this. First, I would just like to know your name. Then I will ask that from the first sentence, I would also ask like this. First, I would just like to know whether you are on any medications or not. And also we can ask that I would just like to know if you have any allergic reactions to aspirin or no. So I can ask from the first sentence.
Mm-hmm. Okay. Mm-hmm. What about explaining the benefits?
It will help you a lot as it thins the blood.
Okay. So, but yes. And about side effects also, benefits and side effects. Do you remember about the side effects? Actually, there is another slide here in my presentation where these side effects are shown. So, and what does the doctor point?
Side effects.
Yes, please.
Sometimes people get muscle cramps, or it can make nausea, or it can cause gastrointestinal bleeding and ulcers. That's about side effect.
Yes.
And abdominal pain also.
Exactly. Does anyone want to add something? No? Okay, so this is the way the doctor points out the side effects and speaks about benefits. And you remember that the doctor also just asks the person to repeat the information. He says, would you like to go through the benefits and side effects one more time? So, well, just to let the patient remember everything, just. Okay, and as you see, so the doctor uses the phrase, for example, go through. So which is actually a phrasal verb, one of the examples of a phrasal verb. And now let us focus on phrasal verbs in details. And here is the example of a phrasal verb, run, plus preposition, particle. And so you can see, so if we use the different particles with run, we get different particles, we get different meanings. So if we use run into, it means to meet someone unexpectedly, like in the example, I ran into my English teacher at the shop. If we use through, run through, it means explain quickly. Let me run through the schedule for the show, just explain what is there. To run on means be powered by, like electric cars run on electricity, not gas. Run up, spend a lot of money on credit. I ran up a debt of £10,000 on my credit cards and run out of, have none left. We need to buy more eggs because we have run out of them. So this is the example of the use of phrasal verbs with run. And so if we have a look at this slide, we can see also one of the examples from the doctor's conversation. So he says to the patient, there's a lot of information to take in at one time. And the verb take in, it means here to understand, a lot of information to understand. It is a separable, so-called separable phrasal verb. Why? Because you can separate the verb take and the particle in. We can say it is difficult to take in the information, the verb and the particle are used together, or we can divide them, separate them, like it is difficult to take information in. It's also possible because it is separable. How should we understand separable or inseparable? So there is a verb to get up, and this verb is an example of an inseparable phrasal verb because you cannot separate the verb and the particle. The example, if you can take the medication soon after you get up in the morning. So verb and particle should be used together, can't be separated. So, and if we speak about why, so we can separate some verbs and we do not separate the others. There is information about this here on this slide. So there's some theory. This is like the phrasal verbs, they belong to two groups of verbs. They're called transitive and intransitive verbs. Transitive verbs means that they have a direct object. And like to look after a pet, for example, but just to look for lost things. So there should be some direct object. And intransitive verbs, they they have no direct object. So, for example, get up. And The transitive phrasal verbs can be separable or inseparable. The intransitive phrasal verbs cannot be separated. And you see the example of inseparable phrasal verb. I'll look after him. And separable, turn off the TV. And we can separate, turn it off. It is used in between the verb and the particle. And so separable transitive phrasal verbs, the examples are given here, like call the appointment off. We can also use like call of the appointment. But if a phrasal verb is separable, it must be separated when its subject is a pronoun like it, her, them. So we should use it in between the verb and the particle. Call it off. The use of call off it is incorrect. We can use a noun between the end, yes, after, like here, call off the appointment, but call it off is incorrect. And there is information about inseparable transitive phrasal verbs, examples. She is just starting to get over the flu, to recover. And so flu is used after the phrasal verb. She's just starting to get over it. So even if we just replace the flu with the pronoun it can't be used in the middle. And the use of, so this sentence, she's just starting to get the flu over is incorrect because this is inseparable verb. And there are examples of inseparable intransitive phrasal verbs which have no direct object. So when we visited Paris, we loved eating out in the sidewalk cafes, which means dine in a restaurant. So we do not separate it out. And day after day, if rain showed up for class 20 minutes late, arrived in the class, show up is also inseparable. Well, and there are some phrasal verbs that always have to be separated, but this is comparatively rare. Like in the example, Oskar will takes when up on the offer, means agreed to his offer. Well, this is the information about phrasal verbs. I hope that you remember this and already know. And so here is the practical exercise. So here we need to rewrite the sentences using the phrasal verbs which are given in the box. And you may have to change form of the verb, or, and you should think, can you, are they separable or inseparable? And just to use them in the correct form, okay? Now let us have a look at the first sentence and listen to Asna. Which phrasal verb should we use in this sentence?
The doctor identified a few benefits and few side effects. It will be pointed out.
Instead of, we have the verb here in the sentence. Yes, there is a verb. Where is it?
Ma'am, can you hear me?
Sorry?
Identified.
Instead of identified, yes. What should be used instead of identified?
Pointed out.
Yes, this is pointed out. Good. Now, please, a couple of minutes to you to do the exercise on your own individually. You should write the sentences and then we'll check. Okay? So please write the sentences. 2 minutes. Well, let us check what we've written. So Shamisha, please, the second sentence.
You could keep a pillbox with days of the week on it and remove the tablets each day. Take out.
Yes, and take out the tablets. Mhm. Okay, so Ramisha, please.
Yes, ma'am. Completing a prescription requires great care. We can use write out a prescription requires great care.
Sorry, will you repeat, please?
Write out.
Yes, but we should use this verb in the form of the gerund, ing at the end, right? So it should be
Writing out.
writing out the prescription.
Right.
Okay, good. Jan Parveen, please.
Yes, ma'am. Don't forget to read the instruction on the label. We can use look at. Don't forget to look at the instruction on the label.
Okay, so Hala Malik. The microphone, Hala Malik.
Sorry, ma'am. Try to adopt a routine for taking medications if you can. Try to get into a routine for taking medications if you can.
Okay, so Sultan.
Yes, ma'am. Sixth one, they contact the hospital immediately if anything changes. get in touch with the hospital immediately if anything changes.
Exactly. Okay. And Sinju?
It works by reducing the workload of the heart. It works by cutting down the workload of the heart.
Great. Well, this is the example. These are examples of the use of phrasal verbs, and there'll be a lot in the test. And yes, now we are going to continue speaking about something we've also started speaking in the previous class when we were reading about a nurse, and she just mentioned the word concordance. Do you remember the meaning of concordance? What does it mean?
Working together with the patient to take the medicines.
Exactly. Okay. And so there is some information. There is statistics for concordance in general practice in the United Kingdom. And as you see, it's not very bright. I mean that sufficient concordance to attain therapeutic objectives occurs about 50% of the time. So who would like to read this information? Danish, please.
Ma'am, statistics for concordance in general practice in the UK. Sufficient concordance to attain therapeutic objectives occurs about 50% of the time. 1:6 patients take medicine exactly as directed. 1:3 take medication as directed 80 to 90% of the time, and 1:3 take medication 40 to 80% of the time, and the remaining 16 to 17 take medication directed below 40% of the time, and 20% of prescriptions are never cashed.
Yes, so you see that 20% of people do not just even take the medications. So, and what do you think, is statistics similar in your country, or is it different? Is the effectiveness of prescriptions the same, like 50%, or is it higher or lower? What do you think? How do people just, what is their, so I mean, do they take medications as directed, or?
It's less, ma'am.
Statistics is even less in your country?
Yes, ma'am. Mostly, yeah, for example, I'm from a village area, and in my village, most of the people, they never go to the hospital as well for getting the medicines. They used to cure their diseases within the home itself, like using some home remedies. So the amount of taking medicines is comparatively less in our area.
But this is not about just what kind of treatment the people get. This is about the already prescribed medications. So
that too, ma'am. When they take the medications, when they get a bit better, then they used to stop the medications, or sometimes they would decide by themselves these medicines are enough. It will be enough for the disease, and they miss some of the medicines in between.
yes.
And it will be changing accordingly. If in our age, if it is about 20 to 30 years old people, they will try to take the medications correctly. But on talking about grandparents, they mostly won't listen to doctors, or they will not take the medications correctly. It depends on age.
And also,
yes, please.
even when the doctor has prescribed the medicine, the patient will decide whether he should take it or not. If something related to some medicines are for sedative medicines are given by the doctor, the patient will neglect it by saying that it will cause extra sleep and all. The patient decides in some cases, patient decides whether to take the medicine or not. And also, as Sinju mentioned, the people after getting a little better, people will stop taking the medicine. They won't complete that course of, if it is given for 1 month period, the people will make and stop it after a week if they get feel better. Even if they didn't feel better, they will say that the doctor is not good or the medicine is not effective, and they will stop. So it depends on the patient exactly.
Yes, and this is a big problem, as you see. So, well, and what are the ways out? I mean that there is the article about concordance. So which let us see if it describes the similarities, as you've said. Let us read this article, and maybe you'll find the ways just to solve this problem. Okay. Well, so let us listen to Ashwati. Will you start reading, please?
Non-compliance in medicine taking is a long-standing problem in all therapeutics areas, including the treatment of cancer. There is a strong evidence that despite the introduction of new medicines which have fewer side effects and are more convenient to use, many people still do not take them as prescribed, even when not doing so can have life-threatening consequences.
Mm-hmm. So there is a name of one of the diseases mentioned here. Which disease is it?
Cancer.
Cancer, yes. Mm-hmm. Okay. Well, let's move on and let us listen to Taib.
Yes, ma'am. Medicines prescribed for preventive purposes are especially likely not to be taken as prescribed. This may be because people do not feel immediately threatened, and in the case of symptomless conditions such as raised cholesterol levels and hypertension, feel no obvious benefit at the time when medicines are taken.
Yes, so this is about prevention. Yes, so they do not like taking such medicine. Okay, now Labib, are you here?
Yes, ma'am.
Read it, please.
Yes. Factors associated with a poor compliance include: first one is complex regimens involving multiple doses and several medicines. Second one, unwanted side effects. Third one, concerns about value or appropriateness of taking medicines in particular contexts. Fourth one, denial of illness, especially among younger people. Last one is the confusion or physical difficulties associated with the medicine taking, which most frequently affect older people.
Mm-hmm. What kind of people are mentioned here in this paragraph, in this part?
Old people.
Old people.
And younger people.
Younger people.
Yes. Mhm. Okay, so these are the factors, and it looks like, so yes, we have about 1 minute left. So, and we need to take a break. So see you in 10 minutes. Okay?
Okay, ma'am.
Okay, ma'am.